First and foremost, Srinivas, thank you very much for taking time out. I know he's based in Gurgaon. He runs the All India operations. They have spread across the country with their 12,000 employees. I'm very curious to see the impact. I know most of us know you as a titan in the advertising stroke, media stroke, marketing field. You made some interesting decisions in your life, including setting up the first media buying specialized unit with HLL way back 30 years ago. Just walk us through, and you are an alumnus of XLRI. Like many of us who stayed loyal to the healthcare stroke pharmaceutical industry, tell us what's so exciting about the area in which you are.
Sure, thank you. Firstly, thank you for having me here. I'm really honored to be, part of your annual day. And, congratulations on your 60th year and, all the fabulous work you've been doing. Bharat ke liye. You're doing amazing work, so thank you. Thanks for having me. I've been in the ad industry for over 30 years, probably not employable anywhere else, which is why I kind of stuck here. But probably I was just lucky because when I was passing out of my management school, it was the year of economic liberalization, and the country was just kind of opening up. So I guess media as a sector, started kind of getting recognized. There was this whole media explosion. Those days it was TV explosion. So one just, went with the flow, and I guess, just happened to stick on. I think a couple of turning points. One was the largest advertiser in India, Hindustan Lever, in the year 1995, decided to, for the first time, this wasn't done in India before, but decided to hand over all of their media planning and buying to one company. Earlier they used to work with multiple companies. So this was really the birth of the media agency industry in India, and I happened to be, I guess, right place, right time. So, worked very closely with Hindustan Lever in those formative years. And I must say the other turning point in my life came, and this is actually not in my CV, but probably the most significant moment in my life was when I turned 40. I actually decided to get out of the corporate world. So I quit my job. I was working in the same company, but one of the group, one of the associate or agencies of WPP. I decided to get out of the corporate world, and I didn't know what I wanted to do, but I just took a break. I guess I was running one of the agencies across Asia Pacific, so I had a very crazy schedule. I used to travel 25 days a month, setting up offices all across Asia for that agency. And then one day I was on a flight back from Shanghai, and I just decided that I've had enough. I didn't know what I was going to do, but I took a break. What I did in that 1 year, I guess, this is going against maybe why we're here for, which is learning and marketing and all of that, is I actually went and joined a music school and learned how to play the tabla. Because it was a childhood passion to play the tabla. I never got a chance to do it as a kid. But just to kind of de-stress myself, I thought maybe this is what I should do. So that 1 year, if I look back, was probably, for me, the most rewarding and enriching year of my life. I came back into the corporate world soon after, maybe after 18 months or so, and here I am with WPP for the last many, many years continuously. But I think in my second innings, I've learned to value each day, each opportunity a lot more because of what I went through during that 1 year of just taking a break and learning how to play the tabla. So, yeah.
That's a remarkable story. For all the CHROs sitting in the room, they'll start worrying now if somebody's going to leave, take a sabbatical for a year. Yeah. You've been heading WPP for almost 8 years now, and you define yourself as a creative transformation company, at the intersection of creativity and technology. Can you talk to us a little bit more about how you've seen this evolving? I think for traditional measures, we've always seen large amount of advertising spends on TVC. We see that that's already shifted completely to digital, social. Yeah. Talk to us a little bit about how you see it from your vantage point, where you sit.
Yeah, again, like all industries, the advertising industry has evolved quite a bit. We spoke about the early 90s being the era of television, and then there was the whole internet or digital era which came in. I think one of the pivotal moments in India was with the launch of Jio and the data prices crashing. India became a mobile-first market, and then everything shifted mostly to the mobile. And all of us see, even anecdotally, the amount of time everyone spends on small screens these days. And of course, in the last few years, it's AI, which is really coming in and disrupting our industry, completely. So been through those evolutions, I would say. One or two things which I'd like to call out. I think the advertising industry, when it started off back in the day, most of it was basis the large FMCG companies which came in as the big brand builders, the serious brand builders, the ones who kind of spent money investing in advertising. You know, I was thinking when I was walking into this event today that, you know, probably the kind of rigor that you bring as a pharma industry to your products is what the FMCG industry brings to marketing. I think if you look at marketing best practices, there's really a lot to learn from that industry. And that's why I think the ad industry, in a way, started in its infancy growing, and all the great ad campaigns of the past would mostly be of FMCG brands. Cut to maybe 20, 25 years ago, we had obviously all the other categories coming in. And once digital came in, it kind of democratized the availability of advertising, the availability of content, the availability of consumers. So today, advertising has become extremely, on the one hand, extremely complex, extremely, you know, challenging for us to even just keep pace because the consumer is always ahead of us. But on the other hand, it's also become equally interesting, equally exciting, because today you can run campaigns where you can literally talk to each individual with a very personalized message at a particular time and influence his or her behavior, while also, you know, kind of addressing the mass. So it's kind of moved from, you know, what we used to call cannonball targeting or mass targeting into highly personalized kind of one-on-one kind of messaging. Again, lots of implications for a sector like pharma. And that's the whole wave that we've seen. So yeah, it's been, and obviously I'm sure there's a lot more disruption in store for us. This also brings me to a point which, again, I was listening to your earlier speech and of course read a little bit about OPPI and, you know, the fact that you also got into GCCs in India and you're creating all of that. So in fact, the way the whole digital revolution has happened in our industry and the way AI is coming in, India is actually today playing a far more strategic role, you know, as an ad market for our global organizations, because we also have, you know, global centers or capability centers here in this market handling and providing some really cutting-edge solutions to our clients globally. So that's the other wave that we're able to ride.
Thanks for that. In fact, as he was talking, I went down memory lane again because I can see Dr. Shailesh Iyengar sitting in the audience there. And Mr. Shahani and Dr. Shailesh had invited Nitin Paranspe to a similar event exactly almost 20 years ago. And they talked extensively about brand building. And very often in the healthcare stroke pharmaceuticals industry, we have stories playing out in our own minds. Yes, we are a highly regulated industry. Compliance governance are really at the center stage. But at the same time, the fundamentals remain the same. It all starts from deep-rooted insights. It all starts from really having powerful creatives to unlock. If you can talk a little bit about how to go back and remove the clutter, because very often we carry all that burden, all, you know, as brand leads, as marketing leads.
No, that's very true. Actually, there's obviously a lot of talk around technology and AI and data and all of that, but I guess what is held true all along and will hold true in the future is ultimately it's the power of creativity that makes a difference. It could be any field, any sector. And again, if you look at the pharma sector, you know, with all the constraints you operate under in terms of what you can do and can't do in terms of marketing and advertising, etc., it's all the more reason that I guess you need to be creative. I mean, the more constraints you have in life, the more creative you need to be to survive. So creativity has stood the test of time, and maybe we can start by showcasing a recent piece of work that you know, we created for Titan Eye Plus. No fancy technology, no fancy AI, just a very simple insight and a very creative way of addressing the challenge. The challenge is, you know, Titan Eye Plus, everyone's aware, spectacles, how do they connect with a target group that's very difficult to reach, and the target group which is always on the move, and not from, you know, the higher rungs of society. So that's just a bit of an intro. If we can play the video to just demonstrate that even today, and this is work done very recently.
Should we move or?
Could we play it now?
in 3 truck drivers in India have compromised vision. Trucks and lorries were involved in over 25,000 crashes and over 10,000 deaths.
सतवन जी, आपने कभी आंखें टेस्ट कराई हैं?
आंखें तो अपने एडजस्ट कर लेती हैं।
आंखें किनकी बचती है ना, जो आपकी उम्र के।
हाँ।
हम लोग पुराने, हम लोग की आंखें, शरीर कुछ नहीं, अभी तक पूरा रीजनल है।
18,000 20 वो कैसे अफोर्ड करेगा?
With many of them living on the road, eye care is surely not their top priority. It is something that they choose to completely ignore and live without. Since they won't come to us, we went to them. In the middle of their long journeys, the truckers' pit stop is at the ubiquitous Indian dhaba that serves them regional home-style food. We removed the old menus from the tables and the walls and replaced it with our eye test menu, which was the only way to order food. Titan Eye Plus, India's expert eye care brand, presents the eye test menu.
EMK।
उसके बाद से नीचे नहीं दिखता है सर, छोटा अक्षर नहीं दिखता।
नहीं दिख रहा। पढ़ाएगा ये नहीं, वो तो बिल्कुल ही नहीं, वो तो ऐसे जीरो लगता है।
Once the truckers knew they had a problem, we had optometrists on site to conduct a thorough eye exam, which was free of cost and would determine what the corrective prescription spectacles would be.
The eye test is devised and designed exactly the way we do in our clinic. The only difference is the alphabets are replaced with the names of menu dishes.
Based on the styles they liked, we shipped the glasses to their home addresses. We expanded the initiative to include rickshaw and cab drivers, last mile delivery personnel, and others at risk.
जितने ट्रक वाले हैं उनको चश्मा लगाना चाहिए, ये लाजमी है, बहुत जरूरी है निगाह वास्ते।
The eye test menu by Titan Eye Plus, a major milestone in making Indian roads safe.
I just find that incredibly powerful. Such a simple insight, and the execution is top class.
That's right. Yeah, I mean, imagine. It's all common sense. Everyone knows that the truckers stop at dabas and spend a lot of time there. And a captive audience, menu cards is what they always read when they go there. Just replace it, do an eye test, get optometricians. So yeah, I mean, done in over 300 towns. I think there were like 30,000 odd or 40,000 odd spectacles. People actually had major sight issues and were still driving trucks. And of course, can be scaled up. But yeah, just shows what one can do with just the power of an idea.
Absolutely. No, I think it's a fantastic example of how, if your insight is sharp, you can really convert that into some incredible execution. Srinivas, also over the last few years, we've seen almost an explosion of the available channels. I mean, gone is the era where you could depend on a print or a TVC. Every customer, every consumer is having, his or her mobile phone, and that has completely changed. How do you really get hold of eyeballs? In our industry, we still depend on our sales reps. As I said, we are still regulated. And these are, again, probably stories we tell in our own minds of what limits we can test. But I would love you to give an example where you also unlocked value using mobile technology. And I know you've done some remarkable work.
Yeah. Yeah, actually, we've moved into this space quite early, even before the so-called smartphone era took off. And I would like to share an example after speaking about it for a couple of minutes. This is for Lifebuoy, one of the biggest soap brands in India, Hindustan Unilever. Again, trying to reach audiences in slightly rural kind of areas, many of whom don't have access to mainstream media, and but had access to the phone, a very basic kind of a feature phone. And this, of course, was done some years ago. The thing is, while you have the mobile phone and are able to reach that person, I think it's more the planning which goes around it in terms of what kind of data sources are available, and how do you kind of mine data to kind of pinpoint at a district, at a town, at a village level, the kind of prevalence of diseases. So it's all available today, right? There's so many data sources. You can do your algorithms, you can do your, today of course you can use AI, those days we use machine learning. So by working on this project, we actually were able to, in a way, with a fair degree of accuracy, pinpoint the prevalence of diseases in different towns and villages in a particular belt of India to a very, very high level of accuracy. Now, this is extremely valuable information when you're planning a media campaign through a mobile phone, because you can theoretically and really reach every individual, right? Now, knowing where the person is, which town, which village, etc., you can, have the relevant messaging around, whichever the disease is or whatever, and of course, use the branding and the messaging around hygiene, etc. So this was done, like I said, many years ago, prior to smartphones, but just using the power of data, analytics, pinpointed targeting, and combining the brand messaging with that, and gave phenomenal results for the brand, for Lifebuoy. So if you can play the video. Before I play the video, is it clear on the screen if we are sitting here, or do we have to move out? Is it fine?
Are we in the way?
Okay, we're not in the way? Okay, so we can play the Lifebuoy video, please.
India's infant mortality rate is 13% higher than the global average. Half of these deaths are caused by preventable diseases like diarrhea and pneumonia and occur in rural areas. Indians primarily eat and feed their children with their hands, not cutlery. Hand washing with a soap is the single most cost-effective intervention to prevent child deaths. Lifebuoy, India's #1 soap brand, wanted to reach these people to change hand washing behavior and reduce the incidence of illness and death. Introducing Lifebuoy's infection alert system. Our solution was to create a data-led infection alert system to help Lifebuoy proactively educate consumers when they are most vulnerable to fatal diseases, and activate it through mobile, which has the highest reach in rural. Fueled with Government of India data collected from 34,000 rural community health centers across 822 villages and sub-districts, the proprietary algorithm simplified big data to help understand the intensity, magnitude and trends of each of 21 communicable diseases at a weekly level. Modeling historical data on these diseases, we derived a predictive incidence rate. When an outbreak was predicted, we activated an automatic calling system that made, on an average, 8 million calls every week, alerting rural consumers contextually on the prevalent disease in their village and educating them on the importance of hand washing with soap as a preventive measure. One step towards healthy India. Lifebuoy.
Absolutely remarkable.
I think all of us are really lucky to be actually based. I keep saying this when I go to and meet my colleagues in London or New York. We're so lucky to be working in a country like India, because I don't think there's any market which gives you the spectrum of opportunities that we have in India. Imagine on the one hand, working on campaigns like this, which can really make a difference in many ways. And on the other hand, we will come to a few examples later where you have, again, using AI, cutting edge technology or whatever, and of course using big Bollywood stars, you can create an impact. So the kind of opportunity, India is pretty much like the R&D lab for the world today, right? In any sector, including in the ad sector, because you can literally test, experiment, learn, and take solutions like these to other markets. Yeah.
Remarkable example. Again, I'm just thinking aloud. For many of us who operate in the area of malaria prevention, dengue prevention, think about the data sources that we already are sitting on. I think the sheer power of predictive modeling and using that to really customize the messaging at an n is equal to 1 level, is the opportunities exist for us. Question is, are we looking in the right places? So again, thanks a lot for that wonderful example. Gen AI in the last 2.5 years, 3 years, at least I didn't know what Gen AI was. Not that I profess to be an expert, but our global CEO is on her Microsoft board. So obviously, every time she visits India, we all learn up in our corporations because she asks questions to us. On a serious note, Gen AI has really redefined the way we use some of the, you gave an example of predictive modeling, but in terms of simplifying things, also customizing things to n is equal to 1 level, which was never possible in the past. Your experience, and I know there are ethical dilemmas, there's still a lot to be done in terms of, for our industry, because we have medico-legal compliances that have to be in place, but the sheer unlock that can happen, if you can talk through.
Yeah, actually, all of you here, especially in the marketing section, brand management, marketing managing, etc. There's obviously the whole marketing value chain, so to speak, of doing your research and your scenario planning, and then obviously coming up with your whole, once you have your product strategy in place, your communication strategy, your media and all of that. That entire value chain today, in a way, is impacted by Gen AI. It's unbelievable, what we have access to, or what all of us have access to today. Let's take the start of the whole cycle, which is, just looking at what's happening in the landscape, looking at trends, looking at, what's the chatter on social media, what are people most worried about, what are people most stressed about, and then you can cut it by Gen Z or millennials or those who are post-60 or whatever else. Everyone's going through different life stages, There's so much of information available today, and there are so many AI engines crawling through all of this, that at the click of a button, you get to know, like within milliseconds almost, what's happening where, kind of a thing. So that's really the start, and that's only the starting point. And then when it comes to, let's say, of course, you still need the human brain, and nothing can beat the human brain in really, let's say, coming up with a creative idea. Of course, there'll always be inputs through all of these AI engines. But I think once that is done, again, if you're getting into content creation and all of that, today AI has really helped us immensely, because what would take us maybe days to create, today you're getting it done in like a few minutes, and you're then spending a lot more time, deliberating, trying to convert it into a solution, so on and so forth. So that's a whole content piece, and there are, content engines which can get built. You can create omni-channel content and so on and so forth in like a few minutes. And then, of course, the whole dissemination, the media, and then the doing the analytics, building the whole feedback loop. So I think at every stage, it's really come in a big way. Just to give you an example, maybe it's some food for thought for your industry. What we've done at WPP is we've built a platform, and we've done it completely ourselves. We call it an intelligent operating system, and it's called WPP Open. So it sits on my phone, it sits on all our phones, it sits on all our laptops. So in a way, at a very simplistic level, we have, on one platform, we basically taken the physical world of WPP, which is, all the creative we do through the creative agencies, the media work we do, the analytics we do, so on and so forth. And we've just put that on one platform, and we've created studios for creative media, etc. So you can see it's a WPP on the net kind of a version. Then what we've done is, in each of these, like whether it's creative media, analytics, PR, the back end is fueled by AI tools. Some of them are off the shelf. Some of them, we've either acquired companies or we're working with startups or whatever else. So under the hood, there is a lot of AI which is kind of constantly working. So today, if somebody has to sit and develop a campaign for one of your, let's say one of your brands, and let's say it's not the regular consumers, let's say with HCP or whatever else. All you have to do is to go into Open, put down all the constraints, and at least it'll start, again, within a few seconds, and I'm not joking here, it'll start giving you lots of different scenarios for you to start thinking about. And then, as you keep asking it questions, as you keep refining your questions, you can actually sit and walk away in about 15, 20 minutes developing a whole campaign, right down to the creative, how it will look and feel, and so on and so forth, thanks to that one platform. So it's like really changed our lives. So what it's helping us do is to then reinvest our energies elsewhere and try and see how do we move up the value chain for our clients, how do we start trying to impact their business solutions, because a lot of the marketing work or campaign work is anyway being done once you have the right kind of questions by this whole platform. And then you move the value chain. So imagine in your case, obviously there's a lot of rigor and science that goes into your products, your formulation and all of that. And obviously you have HCPs. Imagine if you use all the data available, personify each and every, and it's possible today, each and every contact, each and every touch point that you have, personify that person and make things which are so tailor-made and use these engines to kind of deliver them at scale. Whatever is taking like days and months can all be done in a few days. And then now let's figure out what do we do the rest of our time? How do we then get more strategic and so on? So it's game-changing. It's game-changing.
And an example of that?
Okay, very, very interesting piece of work again. Highly acclaimed. This won the Titanium at Cannes, which is the mecca of ad festivals in France, which happens every year. So it's got the highest award a few years ago, and this was created for Cadbury's, for Mondelez. The reason I want to share this example is, of course, there's Shah Rukh Khan is a big Bollywood star and obviously one of the most recognized, people in the country today. But the objective of this campaign was very different. This was just as we were coming out of COVID, as we were coming out of the second phase of COVID, and it was primarily aimed at helping the small Kirana stores, because even today, most of the FMCG sales, as you all know, happen through Kirana networks in India. So how do we help the small Kirana stores get back onto their feet if you have somebody like Shah Rukh Khan, who's a brand ambassador for Cadbury's? So the problem statement is, we have a big brand ambassador, but we have like thousands, millions of Kirana stores, and we don't have too much time with Shah Rukh Khan. We only have signed him up, and we get maybe half an hour, 1 hour in a month or something like that. So we can't waste too much of his time. But there's AI available, there's technology available, there's data available, the PIN codes of all these Kirana store owners. So that's the problem statement. How do you bring it all together with AI and help the Kirana store? So that's a bit of a intro to what I'm going to show you. And now we can play the video, please, of Cadbury's.
But the smaller stores still suffer.
This lockdown has been a real tough phase of my life. I mean, I have seen bad days, but this was the worst.
Last year, we helped small businesses through Diwali. So this year, we decided to bring it back. Presenting not just a Cadbury ad. This Diwali, we helped hundreds of small businesses by making India's biggest brand ambassador be their brand ambassador.
इस दिवाली आप भी ना अपने पास वाले फैशन नोवा एम्पोरियम से ही कपड़ों की शॉपिंग करना, और फिर एम्पायर फुटवेयर, नाम तो सुना होगा, अपना स्टाइलिश चश्मा बगल वाले हेवन आई ऑप्टिशियन से ही लेना, सिद्धि विनायक इलेक्ट्रॉनिक्स से लेटेस्ट स्मार्टफोन खरीदकर धमाकेदार सेल्फी पोस्ट करना।
क्या कर रहे हो? मीठा लाए कि नहीं?
लाया हो ना यार, अपने पास वाले रोशन किराना से। आप भी अपना मीठा वहीं से लेना।
We used machine learning to recreate Shah Rukh Khan's face and voice to take the local store names in the ads.
इस दिवाली आप भी ना अपने पास वाले चॉइस ऑफ फैशन से ही कपड़ों की शॉपिंग करना, पास वाले आजकल फैशन से ही, रॉयल फैशन से ही, एमके क्लॉथ्स से ही, पास वाली लक्ष्मी कलेक्शन से ही कपड़ों की शॉपिंग करना। इस दिवाली आप भी ना अपने पास।
Different versions of the same ad with local store names were targeted as per the PIN code of the viewer, showing them only the nearby stores. But it is impossible to cover all the stores. So we gave the power to the people to create their own version of not just a Cadbury ad. Any small business owner could promote their stores through their own social media networks like WhatsApp forwards and other social media pages.
हमारे आसपास की जो दुकानें हैं, उनकी दिवाली भी तो मीठी होनी चाहिए।
Cadbury celebrations, not just a Cadbury ad.
Well, I'm conscious that we have a lot of lawyers, our legal teams, compliance teams are sitting in the room. So obviously, I am also conscious of the limitations that we might have. But it's again a powerful example of how you can personalize, especially with technology available now. And I'm just thinking aloud, every member company is covered depending on the portfolio, depending on the size of specialty or super specialty, or even mass-based businesses. We cover lakhs of healthcare practitioners. I don't know how many times we can keep borrowing from some of these fundamentals to unlock value. I'm conscious that we could go on. We have a couple of examples more, but I'm also conscious of time. I also wanted to open up the floor because we had kept some time for us to ask questions, keep this interactive, keep the energy in the room. Anyone has any questions that you can ask Srinivas? Can we have the lights and 2 microphones? Asavari? Yeah. Anyone in the room? I can't see anything, so you'll have to. Yes, Mr. Matai.
So this is nothing pertaining to your presentation, but more I would like to hear from you as to what is your external perspective of how you see the pharmaceutical industry in India from the point of view of their outreach. Because it's a closed industry, regulated industry, we say so, which is applicable to other industries as well. But how do you see it? What is your view from outside?
Okay, thank you for the question, sir. I'll probably give this answer as just as a regular, I would say, as a consumer of your industry or your sector. I mean, I think in the last few years, at least, there are a lot of opportunities which have opened up. Just as a someone on the outside, I think one is this whole digital transformation that's happened, and the fact that e-com has taken off in a big way. There's probably telemedicine. There's use of virtual reality, use of bots, use of, all of that. So, and then there's Internet of Things. We're only scratching the surface right now. So there's so much that has happened in the last few years technologically and from a transformation standpoint. If I look at a sector like pharma with all the constraints that we have, it is probably the most, I would say, the lowest hanging fruit, I mean, from this side, to kind of jump onto all of this and really create like a massive amount of best practices, because there's no other option. I mean, you can't create like big campaigns and advertise your brands and advertise your products, etc., because you'll always have to think within that box that has been so clearly defined. So I think somewhere there's a massive opportunity right now for this sector, and especially with so much happening in India. With I mean, like for example, we have massive, like I said, we have a global delivery center. We do a lot of these things for global clients from India. So I think just leaning in and harnessing that the tech wave that's happening in India is maybe one way of looking at it from my perspective. The other is more as, I mean, my own experience of let's say being a caregiver to someone close in the family for many years who had a health issue. Maybe when you're looking at marketing and advertising, I think there is a world beyond just the healthcare professionals. I think, of course, the patients is the next step, and it's probably difficult to reach all the while with the restrictions. But if you look at the caregiver, and in India, we have a culture of caring for our family members, right? I think there's a large base of a target audience, of a target group with which you could start, because the caregiver is also in a healthier frame and state to absorb branding and marketing, unlike the patient. And of course, the HCP is anyway being taken care of. So just that's my own personal experience, because for about 10, 12 years, caring for a very close family member, seeing the person go through, and then always running from pillar to post, or depending on Google, and so on and so forth. So maybe that's something which, just through my own experience, is an opportunity. So that would probably be the other. And thirdly, I mean, this is just a general tip, because it's worked for us and for me personally. Whenever I'm, through my career, whenever I was stuck in with either what call to take, or whether we get into this M&A or not and all of this, sometimes we get caught in our own echo chambers of senior groups and executive committees and all of that. One of the things that's always worked for me is I just cut through the hierarchy and go to almost the junior-most levels of the organization. Because unlike when most of us started our career, today people who are coming into the organization in some areas are far more knowledgeable and have far more exposure. Or let me put it this way, they have a very different kind of an exposure. And I feel, generally speaking, maybe corporates don't leverage, the base or the talent pool that's available there, for some of the important decisions that they take. So we've consciously tried to create, like for example, like many years ago when I was running Group M, which is one of the media companies of WPP, we created a shadow board. We mirrored the senior board of the company with youngsters who were in their 20s. The upper age cap was 29. And we created a shadow board which exactly mirrored the senior leadership. And we used this as a pressure group to the senior board to keep us on our toes. So what's happening in digital? What's happening in mobile? Who's consuming what? Tell us this, tell us that. And we got so much of useful insight because we empowered this group and there was reverse mentoring and all that which happened. So again, when as an industry, as a society, as a nation, we're going through so much of transformation, I think there's so much we can learn from that section of the organization or the industry. So yeah, those are just some broad perspectives.
Thank you very much. Thank you. Anyone else? I think given the limitations of time, I'm conscious that we also want to wait for the awards function. We could go on for hours, because I can assure you, sitting with Srinivas every time is a masterclass. For me personally, every time I meet or talk to him, it's a reflection on what needs to be challenged, because we are all creatures of habit. It's very difficult for many of us who've been in the industry to let go of the past practices, the legacy practices. And I think harnessing this intersection of creativity and technology is something that should stay as if there's any key message, it's not just about technology, because it's not putting in tools for the sake of tools, but what you get out of those tools to really accelerate and unlock those insights. So I think on behalf of the whole group, a big round of applause, and thank you very much, Srinivas, for taking out time, for being here. Truly appreciate you being here. And thanks once again.
Thank you all. Thank you all very much. Thank you.
Thank you. What a wonderful conversation and amazing insights from all the films. I'm sure it struck a chord with all of us, trust me. Especially, I'm sure when I speak for everyone, the Shah Rukh Khan film really touched a chord. Thank you. To express our heartfelt gratitude, may I request Mr. Amitabh Dubey, President-elect OPPI and Managing Director, Novartis Healthcare Private Limited, to kindly present a token of appreciation to our speaker, Mr. CVL Srinivas, and our moderator, Mr. Bhushan Akshikar.